Hello everyone, my name is Bradley and I'll be your CPR instructor today. Today we're going to go over infant CPR. Now before we get started, we're going to go over our emergency action steps. That's going to be the first thing we're going to go over. Our emergency action steps are going to be check, call, and care in that order. So what you're doing is you're checking your scene for safety. Then you would check the unconscious infant by tapping them on the shoulder and the bottom of the feet. Okay? Baby, are you okay? Are you all right? If this baby is not responding, identify someone and have them call 911, such as, hey, you in the red shirt, can you go call 911? This infant is unconscious. Now let's ponder on the call step for a minute. If you are by yourself and no one else is around, for an infant, you want to give 2 minutes worth of care before you call 911. And for the adult and the child, you want to call 911 before you proceed to give care. All right, so now you are at your care step. When we get to our care step, we got to talk about opening the airway. When an infant is unconscious, you want the head to be in the neutral position when you open the airway to do your look, listen, and feel for movement for 10 seconds. And where you're going to check the pulse for the infant is going to be in the arm with 2 fingers, the brachial artery. And you'll be checking that pulse for 10 seconds. If you find the pulse on this infant, we would be doing what is called rescue breathing. In rescue breathing for an infant, we give 1 breath every 3 seconds for 2 minutes. That's 1 breath every 3 seconds for 2 minutes. So you would make your seal around the nose and the mouth to administer those breaths. Never pinch an infant's nose shut. So you would seal off the nose and the mouth, give your first breath, come up and count to 3. 1, 1,000, 2, 1,000, 3. 1, 1,000, 2, 1,000, 3, 1,000. Breath. 1, 1,000, 2, 1,000, 3, 1,000. Breath. Now let's say that's been about 2 minutes. After 2 minutes, I'm going to recheck for the pulse. As long as there is a pulse, I would continue. No pulse, I'm going to begin CPR. Always infant CPR. How deep you'll be compressing will be about 1 inch to 1.5 inches. So it'll look like this. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 30. Open the airway, give your first breath, come up, take a breath, go back down, come up, take a breath, and alternate between compressions and breaths. Okay, so let's review. CPR for an infant is 30 and 2, in which consists of 30 chest compressions to 2 breaths. You are doing CPR. In CPR for an infant, we do what is called CAB. That stands for circulation, airway, and breathing. So in other words, you would start with your 30 compressions. You would open the airway and you would administer the 2 breaths. The only time in which you would stop CPR on an infant would be number 1, EMS comes to relieve you, you can stop CPR. Number 2, the infant revives, you can stop CPR. Number 3, AED shows up on the scene because you have to stop CPR in order to hook the AED up. So those would be the only times in which you would stop CPR. Other than that, you would continue CPR. All right. Thank you for watching Infant CPR. My name is Bradley, and I was your instructor today.